Hello, welcome to my channel. My name is Dr. Anshum Aneja Arora. I'm a practicing pulmonologist in Gurugram, Haryana, India, and today I'll be taking you through the factual points of seasonal influenza and its vaccination. Seasonal influenza presents as common cold, runny nose, headache, fever, body ache, muscle pain, as well as sore throat. In patients who are at risk of severe infection, it can progress to pneumonia and can also be fatal in some cases. Although all age groups can have influenza infection and manifest its symptoms, certain people are at more predisposition to have a severe influenza illness. These include elderly, children less than 5 years, pregnant females, patients with any chronic disease such as heart disease, kidney issues, diabetes, immunosuppressive agents, patients on cardiac medications, or patients on cancer therapy, chemotherapy, as well as HIV/AIDS. Such patients and especially healthcare professionals who are more exposed to this virus can have severe disease. Influenza virus is a seasonal virus which has 4 strains A, B, C and D. Out of these, strains A and B are responsible for seasonal epidemics as well as pandemics. In India, we see 2 seasonal peaks of influenza infection. The event of influenza infection and the number of cases depends largely on the temperature, on seasonal changes, on overcrowding conditions, and even on rainfall. So in India, especially in northern India, we see 2 main peaks. One is in the winter months from February till April, with March being the peak season, as well as the second from July till October, which is during the rainy season. Influenza vaccination is given once a year, and this vaccine can cover both of these seasons and provide a lasting protection for the year. There are 2 kinds of influenza vaccines that can be given. The first one is an inactivated vaccine. This inactivated vaccine does not contain a live virus. It is available in 2 forms, a subunit vaccine as well as a split virion vaccine. The subunit vaccine is a 3rd generation vaccine, so it is more purified and it does not contain actual elements of the virus. Then the live vaccines are intranasal vaccines because they are given, they are absorbed locally also, so they provide both systemic as well as local immunity. However, these live vaccines cannot be given to children less than 2 years, people above 50 years of age, pregnant females, or people having severe egg allergy. Mostly, we prefer to give the inactivated vaccine. Usually, subunit vaccines are preferred. These vaccines contain 4 strains, 2 of influenza A of various H and N subtype, as well as 2 strains of influenza B, which are more prevalent geographically and are determined each year by the World Health Organization, on the basis of which these strains are introduced in the vaccine. So this vaccine is available as a quadrivalent as well as trivalent vaccine. We prefer to give quadrivalent vaccines because it covers more virus strains. It is given in the dose of 0.5 ml intramuscular dose, which is given either in the thigh or in the arm. Vaccine usually does not show many severe side effects, usually local site pain, sometimes redness, very rarely swelling can occur. Very few patients can develop fever that can happen for a single night on the night of vaccination and will self-subside. Rare complications include anaphylaxis or severe allergic reaction. Rarely syndromes like Guillain-Barré syndrome have been reported. However, they are very less frequent. The vaccine is usually safe across all age groups. It is safely given to pregnant females and infants as well. In the contraindications of vaccination, people who have a known allergy to the vaccine, known allergy to chicken egg, or allergy to any component of the vaccine, or have had severe allergy to or anaphylaxis to any agent should avoid taking the vaccine and should talk to their primary care provider before vaccination. If you are taking this vaccine and you have taken a COVID vaccine or any other viral vaccine, then preferably a minimum duration of 2 weeks should lapse between the last vaccination and the new vaccination. Remember, this is the minimum duration. Safely within a month of administration of a previous vaccine, we can give influenza vaccine. A lot of people ask us if this vaccine can be taken along with pneumococcal vaccine or the vaccine that protects against pneumonia. The answer is yes. The vaccine can be taken simultaneously on the other arm when pneumococcal vaccine is given and is absolutely safe. The timing of the vaccination largely depends on the geographical area that we are living and whether influenza strain in this area is more prevalent in the winter months or in the rainy season, or in the temperate zone if it's prevalent most of the summer months as well. In northern India, we usually prefer to give vaccination starting early May till August. The peak of the season usually occurs in September, so we intend to vaccinate most of our individuals before August. As well as for people who are in the northern India like Kashmir and in the colder areas, we prefer to vaccinate them before the prior of peak winters. So usually by November, December, the patients would receive most vaccinations. In the rest of the country also, usually May, June onwards till August is the ideal time to get vaccinated. So is this vaccine efficacious? This is one of the most common questions that a lot of patients ask us. If we talk about statistics, then various studies have found out that these vaccines can prevent severe influenza infections to the tune of 58 to 65%. So that is a good sense of immunity in the wake of severe infections, severe pneumonias that it may cause, especially like the swine flu pandemic as well as the H5N1 pandemics and epidemics that have occurred in the past in India as well. The infections of cold, cough, upper respiratory tract infections are seen much milder and much less frequent in patients who take regular vaccines. Therefore, it is highly recommended that each patient, especially all patients who are suffering from any respiratory illness, allergy, asthma, chronic obstructive pulmonary disease, as well as general systemic issues like heart disease, diabetes, they must take their annual vaccination as a good preventive step and for a healthy living. So take your dose of influenza shot or flu jab this year and stay protected from this very common and easily preventable menace. Take care, stay healthy and happy living.